Hi everyone, welcome to Nrsg1022 Advanced Healing Arts. We will briefly discuss the course documents, resources and expectations, and then we're going to get started pretty much right away in some stuff. So, what is Advanced Healing Arts? In Advanced Healing Arts, we will explore more complex nursing skills. To be a safe, competent nurse, it is vital you understand not only the steps to doing this skill, but also the theoretical principles and rationale for these skills. Patients and unregulated care providers are often taught to do some of these skills. However, they do not learn who, what, where, when, and why. They do not apply the level of understanding and critical thinking required of the nurse doing this skill. For example, in the pictures in this slide, we see a nurse appropriately landmarking the ventrogluteal intramuscular injection site and correctly holding the IM injection prior to administration. We also see an intravenous blood transfusion set to indicate there's specific equipment required for many of our advanced skills. The picture of the pills is to remind us that we're responsible to know any medication we are given, why it has been prescribed for that particular patient, any side effects, any pre-administration assessments, the expected response to this treatment, and how to safely store medications. The dumping syndrome image in the top right is to remind us of the importance of assessment before, during, and after performing nursing skills. In this situation, we need to recognize the negative side effects of tube feeding and what to do to prevent or mitigate these. Other images include an intravenous access device situated in the patient's arm, which remind us that all IV sites must be assessed every shift, unless there's an active IV running, and then they must be assessed at least every hour. What happens if we don't assess and monitor and know our theory? The final image is that of adults and children who have experienced horrific outcomes from poorly administered and monitored IV therapies and intravenous medications. You need to know your stuff. Our Blackboard shell is open. You will enter the announcements page, and I've added the course exams and critiques in the course calendar so you can easily see when these are due. The course documents, the course concepts, exams and critiques are also areas you'll use frequently. You'll notice that the concepts are not set up by week, but instead by concept. Some of the documents that you'll need to download and save are the course outline, the course syllabus, the weekly schedule, and the lab manual. Why do you need to do the learner preps and complete the lab manuals each week? These questions have been created to help you identify important information using your Canadian Fundamentals of Nursing, our Cozier textbook, which I've placed into each course concept on Blackboard. Save this learner manual. You will be expected to have knowledge of these skills not only in this semester, but also in Year 2, semesters 3, 4, and 5, and many of the concepts tested on the College of Nurses of Ontario REX-PN Entry to Practice Registration Exam. I know this because I'll be teaching you in Profession of Nursing 4, where I have created tests, quizzes, and exams to help prepare you for that registration exam based on some of these AHA concepts. The weekly schedule is posted under Documents. Please make sure you refer to this each week, as you're required to have your learner preps completed before the Monday of each week. Please note that Monday the 15th of February is Family Day, so we will not have class that day. However, I will post a short video lecture, and you'll be expected to have your readings and learner preps done for lab on Tuesday or Wednesday. Please make note of the 6 quiz dates. Quizzes will not be reopened for any reason if missed. Our midterm exam falls week 7. This is there is no specific exam review for this. Instead, each week we're going to do activities, informal tests, test your knowledge, complete case studies during our class time in order to help you prep for these quizzes and exams. So come prepared to class having your lab manual completed. There's one critique before March break. That's the catheterization week 4. Get your practice done in lab. Note that the open labs are available by appointment on Mondays from 9 to 12 and 1 to 4. Our break week falls March 8th to 12th. The semester ends the week of April 19th, and our final exam will be held that week. This is our exam and critique schedule. You will also find the course syllabus on the course syllabus, and you will also find it on Blackboard under exams and critiques. There is a downloadable document of this there. Please set reminders for yourself so you do not miss these dates and times. Now that we're in semester 2, you're expected to demonstrate good time management and organization. So what do you need to accomplish this week, week 1? Week 1 is quite busy getting organized with all the different courses starting up. It'll be easier as the semester goes on. However, this week you'll not only need to download the course documents for our particular course, as I mentioned on previous slides, but you'll also need to make note of the course schedule, exams, and critiques. You also must review the content and concepts, including week 1 introduction. Take a quick look at medical terminology so you know the setup. And you need to start into the concept of urinary catheterization. This one is nice to begin with, as I bring in content you've learned in Fundamental Healing Arts to complement the information you're going to learn in this course. This was a brief introduction to our AHA course. Nursing not only requires knowledge of skills, but it also requires effective time management, prioritization, critical thinking, and emotional regulation. As a nursing student, this is a good time to learn how to do this, because when you're working as a nurse, you need to have built these abilities. So what should you prioritize this week? Your priority for week 1 is to create a weekly schedule for your courses, a 7-day schedule. When we do not have an effective weekly schedule, particularly when life gets busy, and particularly during these times when we're not face-to-face, it can be easy to get behind and feel overwhelmed. So, what resources are there? The Georgian College Library has useful resources pre-created for you. One example of the resources there are the planning templates. There is a winter 2021 semester plan, so you can put all your courses, specifically tests, exams, and critiques on each course. I have sent this out to your instructors, and I'm hoping to receive it back within the week so I can post this for you. This way you can quickly see what tests, exam assignments are coming up each week. Another useful resource is the weekly schedule. This is a blank template that you can use to help you plan your day. I know not everything can go as planned each day, but having a daily plan allows you to schedule important things like meals, self-care, class times, study times, and personal priorities, such as caring for family members. I've already started your semester schedule for you and posted it under documents with the AHA tests and exams and concepts listed. And if you check out week 1 introduction on Blackboard, you will see how you can get an extra mark in this course by completing your weekly schedule for me and submitting it to me by the deadline stated there. Look forward to seeing you in class. Bye for now.